Emergency room duty is one of the most stressful experience for any young doctor. Patients come with different presentations like acute breathlessness, acute chest pain, seizures, unconsciousness, and within minutes, you have to decide who is stable, who is dying, and what to do first. In today's video, we are going to see what are the 5 most common presentations in ER and a practical approach that every young doctor must know. This is not about textbook theory, but this is about surviving ER duty safely and confidently. So friends, today's video is very important. You see this video till the end. And if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. So friends, without wasting much time, let's start the video. So the first most common presentation that we see in the emergency room is of acute fever. Now, what are the different causes of acute fever with which patient comes in ER? The most common causes are: first is pneumonia, second is urinary tract infection, third is gastroenteritis, fourth is tropical infections like malaria, dengue, etc. And fifth are the soft tissue infections like cellulitis. Now, what are the red flag signs in case of acute fever? So, the first is hypotension. It indicates that patient may be in the septic shock. Second is the respiratory distress. It may be either due to pneumonia or it may be due to acidosis that is developing. Third is oliguria. It again indicates shock and reduced perfusion. Altered sensorium also indicate reduced perfusion, or it can also be due to some uncommon infections like encephalitis. Then the last but not the least is the important sign of rash. This indicates the hemorrhagic fever. So these are the important red flags in acute fever. What are the important points in the management of acute fever? The first important point is of ABC assessment: airway, breathing, and circulation. Second important point is fluid resuscitation. In case of shock, first we give fluid to improve the perfusion. And the third important point is that we have to send appropriate cultures and specific tests to identify the cause of infection. Then is the early antimicrobials. The earlier we give antimicrobials, better is the survival of the patient. And fifth important point is about the source control. Sometimes only giving antimicrobials will not be useful, but you have to do source control. Like for example, if the patient is having any abscess, then you have to drain it. So these are the important points in the management of acute fever. Now, the second important presentation that we see in the ER is of acute chest pain. Now, what are the common causes of acute chest pain? The common causes are myocardial infarction, then aortic dissection, pulmonary embolism, acute pericarditis, and pneumothorax. There is a short form to remember these causes like MAP. In this way, you can remember the common causes of acute chest pain. Now, what are the red flags in case of acute chest pain? So, the first is hypotension. The hypotension indicate that patient may be in the cardiogenic shock. Then arrhythmias. Arrhythmias are very common in case of myocardial infarction, and in this case, patient can go in cardiac arrest. Third is the low SpO2. Low SpO2 indicate that patient may be in the cardiac failure and developing pulmonary edema. Then altered sensorium. Altered sensorium can be either due to shock or it can be also due to aortic dissection extending into the carotid arteries, and also sometimes there can be neurodeficit due to the problem of aortic dissection. So these are the different red flags in case of acute chest pain. Now, what are the important points in the management of acute chest pain? So the first point, it will be always ABC assessment. Second important point is that ECG has to be done within 10 minutes. The most common cause of acute chest pain in ER is a myocardial infarction. So ECG is must and it has to be done within 10 minutes. Then IV access has to be done urgently, and some important blood tests like cardiac enzymes has to be sent urgently. Cardiac monitoring here is very important because in this case, patient can anytime develop arrhythmia, which you have to manage very urgently. Then point of care ultrasound focus. It can tremendously help you at the bedside for diagnosing different types of causes of acute chest pain. So friends, in this way, this is the important second presentation in ER, that is of acute chest pain. Now, the third important presentation in ER is of acute breathlessness. Now, what are the common causes for this acute breathlessness? The common causes are, first is the asthma or COPD, second is the pulmonary edema, third is pneumonia, fourth is pulmonary embolism, and the fifth is pneumothorax. So, these are the important causes of acute breathlessness in ER. Now, what are the red flags in this presentation of acute breathlessness? Inability to speak full sentence. It indicates that patient is developing respiratory failure. Silent chest. Silent chest is a very dangerous sign in case of bronchial asthma because it indicates that patient is not able to breathe at all. Third important red flag is SpO2 below 90%. It indicates that patient is developing hypoxia. Altered sensorium can also be seen if there is hypoxia or even if patient is retaining CO2. Then hypotension. Hypotension is also an important sign that is commonly we see in pneumothorax. So these are the important red flags in acute breathlessness. Now, what are the important points in the management of acute breathlessness? First, always it is ABC assessment. Second, here you have to provide oxygen and monitor SpO2. In case of COPD, you have to take a important caution that COPD patients, they depend on the hypoxic drive. So here you have to restrict oxygen such that the SpO2 is 88 to 92%. Otherwise, patient can go into CO2 narcosis. Chest X-ray and ABG, these are the very important bedside investigations that you have to get early in case of acute breathlessness. Focus, that is point of care ultrasound, is tremendously helpful in acute breathlessness also in detecting various type of causes. And NIV and ventilatory support. In case the patient is developing respiratory failure, then you have to go for non-invasive ventilation or invasive ventilatory support. So this was our third important presentation, that is of acute breathlessness. Now the fourth important presentation in ER is of altered sensorium. Now what are the important common causes of presentation of altered sensorium? The most common and which can be easily treatable is hypoglycemia. Then it is stroke, then electrolyte imbalances, then septic encephalopathy, and drugs and poisoning. These are the important causes of altered sensorium. Now, what are the red flags here? The important red flag signs are airway compromise. If the patient is having a compromised airway, you have to urgently take certain steps to prevent hypoxia. So first is airway compromise, then respiratory depression, then seizures, then focal neurological deficits because they indicate stroke, and signs of raised ICP. This is also a important red flag sign because here patient can immediately get into respiratory and cardiac arrest. Now, what are the important points in the management of altered sensorium? So the first is ABC assessment. Second important point is that you have to immediately check the blood sugar because hypoglycemia is very treatable. Then you have to do a rapid neurological assessment, and CT and MRI, they are the very important investigations in case of altered sensorium. And fifth important thing is that if the patient has come to you in the golden hours, then you can go for stroke thrombolysis in case of non-hemorrhagic stroke. So this was the fourth common presentation of altered sensorium. Now the last but not the least is the presentation of acute abdominal pain. The common causes here are acute appendicitis, acute pancreatitis, intestinal obstruction, perforation peritonitis, and acute cholecystitis. The important red flag signs are board-like rigidity, abdominal distension, persistent vomiting. Then if the patient is in shock or if the patient is having altered sensorium, these are all the red flag signs in case of acute abdomen. The important points in the management of acute abdomen are like ABC assessment, which is common in all. Then you have to keep patient nil by mouth, because this patient can anytime need surgery, or patient may be having paralytic ileus, etc. Then IV fluids are very important, because patient may be nil by mouth and you have to correct the electrolytes. X-rays, especially X-ray abdomen, USG, abdomen pelvis and CT abdomen. These are the important investigations in acute abdominal pain. And here early surgical consultation has to be done, because patient may need anytime exploratory laparotomy. So friends, in this way, these are the 5 most common presentations in ER that we have seen today. So the first was acute fever, then acute chest pain, then acute breathlessness, altered sensorium, and acute abdomen. As a young doctor, remember that ER duty is about priorities. Stabilize first, investigate next, and then manage the cost. And also try to identify the red flag signs early. If you find today's video helpful, give it a like, share with your friends, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. And also tell me in the comment box which type of ER presentation you find it most challenging to manage. See you in the next video. Till then,